Most people with type 2 diabetes believe they are doing the right thing. They gave up soda. They switched to brown rice. They are counting carbohydrates, watching portions, and taking their medication faithfully every morning. They feel responsible. They feel in control. They are wrong. And every single meal they eat is quietly proving it. Here is what no one has told you. The damage from type 2 diabetes does not happen because of obvious sugar. It does not happen because of a single bad meal. It happens in a window of time most people never even think about, the 2 hours after every meal. Every breakfast, every lunch, every dinner. A window when blood sugar surges, vessel walls inflame, and the slow, invisible destruction of your nerves, your kidneys, and your heart silently accelerates. You cannot feel it happening. Your body sends no alarm. You finish your meal, clean the table, sit down to watch television, and feel completely fine. Meanwhile, inside your blood vessels, a biological cascade is already underway, one that, repeated 3 times a day, year after year, adds up to the catastrophic outcomes I see in my practice every single week. I'm Dr. Lisa Johnson. I am a cardiologist with 15 years of clinical experience. In cardiology, we see the end result of this invisible damage. We see the heart that finally gave out, the kidney that quietly failed, the foot that could not be saved. We sit across from patients who did everything their doctor told them to do, and still ended up in my office. Today, I am going to show you 5 hidden dangers happening inside your body every single time you eat the wrong meal with type 2 diabetes. Each one is more serious than the last, and then I am going to show you the one scientifically constructed meal, backed by peer-reviewed research, that reverses every single one of them, starting with your very next meal. Do not leave before we get to danger number 4, because that one is the one that surprises my patients the most, and it is almost certainly something you are doing right now. In my 15 years of clinical cardiology, I have watched the same pattern repeat itself over and over again. A patient comes in, they have been managing their type 2 diabetes by the book. They are following the generic advice their primary care doctor gave them at diagnosis, and yet their A1C is creeping upward. Their blood pressure is climbing, their cholesterol panels are getting worse, and when I ask them to walk me through what they actually eat, the answer tells me everything. They are not eating badly by the general standards most people know. They are eating in a way that is specifically wrong for a diabetic body over 60, and no one has ever explained to them why. Here is the critical fact that should change everything about how you approach your next meal. A 2022 analysis published in the journal Nature Medicine tracked over 200 patients with type 2 diabetes across a 12-week dietary intervention. The patients who changed not just what they ate, but how they structured each meal, saw A1C reductions averaging 1.1 percentage points, without any change to their medications. Without any change to their exercise, just the meal, just the structure. That number may sound small. It is not. A 1-point reduction in A1C corresponds to a 21% reduction in diabetes-related deaths and a 37% reduction in microvascular complications, eyes, kidneys, nerves. The meal matters more than most doctors are telling you, and the dangers of eating the wrong one are more serious than you have been told. Let's talk about them. Before we get into the 5 hidden dangers, I need to dismantle one assumption, because this assumption is the reason most standard diabetic dietary advice is quietly failing people over 60 right now. The assumption is this: managing type 2 diabetes is about avoiding sugar. It is not. At least not in the way you think. The blood sugar spikes that are damaging your vessels right now are not primarily coming from the obvious foods. They are coming from the foods on your doctor's approved list: whole grain bread, brown rice, oatmeal, low-fat fruit yogurt, fruit juice, bananas. These foods are producing invisible glucose surges in older adults 3 times a day. Here is why. Past the age of 60, the insulin response slows. The pancreatic beta cells that produce insulin become less efficient. The muscle cells that should absorb glucose become progressively resistant to insulin's signal. The same meal that produced a moderate blood sugar response at age 40 produces a dramatic spike at age 67. The biology changed. The dietary advice did not. Now let me show you exactly what is happening inside your body when you eat the wrong meal. 5 dangers, 5 mechanisms, all of them invisible, all of them happening right now. Hidden danger number 1, the post-meal glucose surge. The attack that happens 3 times a day while you feel nothing. Most people with type 2 diabetes monitor their fasting blood sugar. They check it in the morning before breakfast and feel reassured when the number looks reasonable. That number is almost meaningless. The damage is not happening in the fasting state. The damage is happening in the post-meal state, specifically in the 1 to 2 hours after eating. And in older adults with type 2 diabetes, post-meal blood sugar levels are routinely reaching levels that most people have no idea are dangerous. A post-meal glucose reading above 140 milligrams per deciliter triggers a process called glycation, where sugar molecules bind to proteins throughout the body. This includes the proteins that make up your blood vessel walls. Glycation makes those walls stiff, inflamed, and vulnerable to plaque buildup. It damages the tiny vessels supplying your kidneys, your retinas, and the nerve fibers in your feet and hands. According to research published in the journal Diabetologia, post-meal glucose spikes are a stronger independent predictor of cardiovascular mortality than fasting glucose, or even A1C. Not the number in the morning, the number 2 hours after your meal. The patients I see in my clinic who are experiencing the most rapid cardiovascular decline are almost always the ones whose post-meal glucose is spiking above 160, 170, even 180 milligrams per deciliter 3 times a day. Every day, week after week. This is danger number 1. Quiet, invisible, happening to you right now. And it gets worse. Hidden danger number 2, the carbohydrate first mistake. The eating habit that guarantees a glucose spike before you finish your meal. Here is a question I want you to think about honestly. When you sit down to eat, what do you eat first? For most people, the answer is whatever is closest on the plate. Often that means bread, rice, pasta, or fruit. A starchy carbohydrate consumed before anything else. And that single habit is one of the most damaging things a person with type 2 diabetes can do at every meal. When carbohydrates are consumed first on an empty stomach, they are digested and absorbed at maximum speed. Nothing slows them down. No protein to trigger a slowing of gastric emptying. No fiber to create an absorptive barrier in the intestine. Glucose rushes from the small intestine into the bloodstream in a rapid, concentrated wave. The pancreas scrambles to produce insulin. In a body with insulin resistance, that scramble produces a delayed and inadequate response. A study published in the journal Diabetes Care confirmed this with striking clarity. Participants who ate carbohydrates before protein and vegetables produced post-meal glucose readings that were on average 29% higher than when they ate the same foods in the reverse order. 29% from the same meal, just a different sequence. Think about how many years you have been eating your carbohydrates first. Think about how many thousands of glucose spikes that represents. Each one glycating your vessel walls, each one pushing your A1C upward, each one a consequence of a habit no one ever told you to change. This is danger number 2, and most people do it at every single meal. Hidden danger number 3, the wrong carbohydrate trap. Why whole grain bread is quietly spiking your blood sugar. After the diagnosis, most people make the switch. White bread becomes whole grain bread. White rice becomes brown rice. Regular pasta becomes whole wheat pasta. And they feel virtuous. They feel like they made the right choice. Here is the problem. The glycemic difference between white bread and whole grain bread in the body of a person over 60 with insulin resistance is far smaller than you have been led to believe. A 2021 study from the Weizmann Institute found that in adults with metabolic dysfunction, whole grain bread produced blood sugar responses that were nearly identical to white bread in a significant portion of participants. The fiber content of commercial whole grain bread is often too low, and the starch has been milled to a fine enough particle size that it is digested almost as rapidly as white flour. The right carbohydrate for a diabetic body is not whole grain bread. It is resistant starch. Resistant starch is a specific type of carbohydrate that resists digestion in the small intestine. It does not break down into glucose. It passes into the large intestine intact, where it ferments and feeds beneficial gut bacteria. The blood sugar response it produces is 50 to 70% lower than regular starch. The sources are cooked and cooled rice, which undergoes a structural transformation during cooling that converts regular starch into resistant starch, and legumes such as lentils, black beans, and chickpeas. Michelle, a 67-year-old patient who sat in my office 8 months ago, made this one change. She replaced her whole grain bread and brown rice with a cup of lentils as her primary carbohydrate. Her 2-hour post-meal glucose dropped by 61 points within 6 weeks. Her doctor asked her what medication she had added. It was food, just the right food. This is danger number 3. You have been eating the right category of food and the wrong kind of it. Hidden danger number 4, the fat avoidance error. The one thing you were told to remove that is actually making your blood sugar worse. This is the one I promised would surprise you, and I want you to take a breath before I say this, because it goes against almost everything the conventional diabetic dietary advice has told you. Avoiding fat at meals is making your blood sugar worse. Let me be precise. Avoiding healthy fat is making your blood sugar worse. Here is the mechanism. Fat slows gastric emptying. When healthy fat is present in a meal, the stomach takes longer to release its contents into the small intestine. This extends the time over which glucose is absorbed. The result is a slower, gentler, lower blood sugar curve rather than a sharp spike. When you remove fat from a meal and replace it with more carbohydrate, which is what happens in most low-fat eating patterns, you accelerate gastric emptying, increase the glycemic load of the meal, and produce a faster and higher glucose peak. Research published in the American Journal of Clinical Nutrition found that adding healthy fat to a carbohydrate-containing meal reduced the glycemic response of that meal by an average of 30%. And monounsaturated fat specifically, found in avocado and extra virgin olive oil, has been shown to improve insulin sensitivity in skeletal muscle independent of weight change. A 2019 study in the journal Nutrients confirmed that a dietary pattern high in monounsaturated fat produced significant A1C reductions in type 2 diabetics within 12 weeks. The patients I see who are struggling most with blood sugar control are often the ones who have been on a low-fat diet for years. They removed fat. They replaced it with whole grain carbohydrates. Their blood sugar never came under control, and no one ever explained to them why. This is danger number 4, and it has been hiding in plain sight inside decades of well-intentioned but incomplete advice. Hidden danger number 5, the missing fiber shield. The gut mechanism that could be preventing every spike and isn't. The 5th hidden danger is not a food you are eating. It is a mechanism your body is missing. Inside a healthy gut, soluble fiber dissolves in water and forms a thick, viscous gel along the wall of the small intestine. This gel acts as a physical barrier between ingested carbohydrates and the cells that absorb them. When glucose has to pass through that gel to reach your bloodstream, the absorption rate slows dramatically. Without that fiber shield in place, glucose passes directly from your small intestine into your bloodstream at maximum speed. The post-meal spike is faster, higher, and more damaging. A landmark analysis in The Lancet found that high-fiber dietary patterns reduced the risk of developing type 2 diabetes by 35%. A 2020 meta-analysis in the journal Gut found that increasing dietary fiber in people who already had type 2 diabetes produced measurable reductions in A1C within 12 weeks. Not years, weeks. But here's the part that almost nobody explains. The fiber that creates this shield must be present in the right form at the right time. It must be consumed before the carbohydrate enters the stomach, and it must come from non-starchy vegetables eaten as the second course of the meal, after protein and before any starch. Most older adults with type 2 diabetes eat their vegetables as a side dish, a small serving alongside the pasta or rice. That is not enough, and the timing is wrong. The shield must be built before the glucose flood arrives, not during it. This is danger number 5, and correcting it, alongside every other danger on this list, is exactly what the meal I am about to show you accomplishes. 5 hidden dangers, 5 invisible mechanisms, and one meal that addresses every single one of them simultaneously. I call it the insulin reset meal, and this is what it looks like. 10 minutes before you eat, drink 1 tablespoon of apple cider vinegar diluted in a full glass of water. The acetic acid in vinegar inhibits alpha amylase, the enzyme that breaks down starch in the small intestine. It also activates AMPK inside your muscle cells, which opens an insulin-independent pathway for glucose uptake. Your muscles absorb glucose without waiting for insulin to unlock the door. This directly addresses danger number 1. First on your plate, you eat lean protein, 3 ounces of grilled salmon, 2 eggs, or plain Greek yogurt, eaten before anything else. This triggers GLP-1, slows gastric emptying, and primes your insulin response before glucose even arrives. This directly addresses danger number 2. Second on your plate, you eat 2 cups of non-starchy vegetables, broccoli, spinach, cabbage, green beans, eaten before the carbohydrate. This builds the fiber shield inside your small intestine before the glucose arrives. This directly addresses danger number 5. Third, you eat 1 cup of legumes as your carbohydrate, lentils, black beans, or chickpeas, or cooled cooked rice if lentils are not available. Resistant starch that the small intestine cannot rapidly digest. This directly addresses danger number 3. Finally, you add healthy fat, half an avocado, 2 tablespoons of extra virgin olive oil. This slows the entire digestive process and directly improves insulin sensitivity in your muscles. This directly addresses danger number 4. 1 meal, 5 solutions. 5 dangers neutralized at the same time. This is not a complicated meal. It is a deliberate one, and the difference is everything. Let me bring this all the way home. 5 hidden dangers happening in your body right now with type 2 diabetes. Number 1. Post-meal glucose surges, happening 3 times a day, every day, silently damaging your blood vessels with each spike. Number 2. Eating carbohydrates first, guaranteeing a maximum speed glucose flood before your insulin response is ready. Number 3. Choosing the wrong carbohydrate. Whole grain bread and brown rice are behaving like regular starch in an older, insulin-resistant body. Number 4. Avoiding fat, removing the one nutrient that slows gastric emptying and softens the glucose curve. Number 5. Missing the fiber shield, because the vegetables are arriving too late to build the protective barrier in your small intestine. And the one meal that reverses all five: diluted apple cider vinegar before eating, lean protein first, non-starchy vegetables second, resistant starch as the carbohydrate, and healthy monounsaturated fat to anchor everything together. Here is your single action for tonight. Write down these 5 components right now. Just write them down. Tomorrow morning, build one meal using this structure. One meal. Give it 4 weeks. Then ask your doctor to check your 2-hour post-meal glucose. Show them what the right meal does to the right body. Before you go, I want to hear from you in the comments. Which of these 5 hidden dangers surprised you the most? Which one do you think you have been doing without knowing? Tell me below. Your answer shapes what I cover next. Everything I have shared today is grounded in published research and my 15 years of clinical cardiology experience. Your situation is unique. Before changing your medications or your care routine, please speak with your own physician who knows your full medical history. That conversation is always worth having. I'm Dr. Lisa Johnson. Stay informed, stay strong. See you in the next video. Don't forget to subscribe.